Today we'd like to have a discussion about why conflict occurs and how you can move from a place of conflict to a place of resolution. And we're going to talk about it specifically in the realm of a healthcare working environment. And this is an important discussion to have because unfortunately, conflicts are inevitable. And they're often the result of unmet expectations, and sometimes because people have opposing views or values or needs or even wants.
In the world of healthcare, we find that conflict typically falls into one of the following three categories. So the first is issue-based conflict. So the root of the issue here is a difference in opinion of the method or the approach that we take when trying to reach a shared goal or expectation. Second, we have ego-based conflict. And usually the conflict or disagreement is exacerbated or complicated by the risk of one or more parties involved having their self-esteem lowered, or possibly an issue with their personal standing in the relationship. And then finally, we have values or ethics driven conflict. And the root of the disagreement is usually a difference in opinion when it comes to moral and ethical values, both personally and professionally. So we're going to dive into some specific examples of each of those types of conflict a little bit later in our discussion. But as Matt said, conflict is inevitable. We're going to run into it. And unfortunately, human nature is to avoid conflict at all costs instead of going at it head on. And in a healthcare setting, this can be problematic as there's going to be dissatisfaction on the team, but ultimately that can lead to poor patient outcomes and overall group cohesion.
Yeah, that's right. And that's why it's so important that the goal be to pursue conflict resolution and not settle for conflict, avoidance. And so what do you do? How do you move forward in a situation like this? You really want to move forward and have a couple goals in mind. And the first is to say, we need to reconcile this relationship between those that are involved in the conflict. That needs to take place. And let's try to find a solution so that you can start working well together again and that you can provide the best care for the patients. That's the ultimate goal, right? And then secondly, we also want to make sure that both people involved go through this process of reconciliation and conflict resolution because it's going to help them grow both personally and professionally. Really, the best way to pursue these things is through something called the pause principle. We're going to walk through that because pause is an acronym for 5 steps. And if you have these 5 steps employed in a conflict resolution, it's going to lead to the best possible results in trying to see things reconciled and seeing that path forward. So let's just talk through these 5 things. If you start with the letter P, it stands for the word prepare. Before you sit down and have a conversation where you're trying to kind of address the conflict at hand, it's important that you spend some time preparing ahead of time. Let's not go in kind of a raw emotional state. Let's take a step back and either internally or even in a discussion with somebody else, kind of work through what were the facts of the situation. Let's not just get hung up on our feelings and the emotion that took place when a conflict occurred, but let's think through what really did happen. What was this person thinking? How did I respond to it? Make sure that you have a clear understanding of what really took place. Also, maybe you can seek out some wise counsel. Do you have a coworker? Do you have a mentor or somebody else in your life, a parent, that you could turn to and say, hey, have you ever been through something like this before? Am I thinking about this situation the right way? Or am I maybe missing something? And then finally, can you think through what are some possible options in terms of a path forward that you'd be willing to take? What are some possible solutions that you can be thinking through in terms of how to resolve things and how to work things out with this coworker? So that's the letter P. The letter A then is not just preparing, but now when you sit down and start talking with this person, it's really important. The letter A stands for affirm relationships. And it's very important that when you're trying to resolve a conflict, that person thinks that you have a genuine concern for them and that there's a healthy level, kind of a mutual respect between you two as peers and coworkers. If they think that you're coming across as condescending or judgmental, or maybe blame shifting. You're thinking this is really their problem. That's really going to slam the door shut for any type of conflict resolution. And working together and finding solutions is really not going to happen. And so how can you affirm that this is somebody that I respect, this is somebody that I care for? That needs to be at the forefront of this conversation and this process of reconciliation. So that's the letter A. When we get to the letter U then, that's trying to understand the interests of the other person. I mentioned just a moment ago that really behind many of the causes of conflict is a misunderstanding or maybe having differing opinions or differing needs or wants. And sometimes we don't understand where the other person's coming from. So sitting down and trying to get to that place with each other and say, what were you thinking when you approached things this way? And here's why I had a different opinion, or maybe this is why I approached things in a different way that you disagreed with. If you're able to come to that common ground, you're going to realize that, especially in a healthcare situation, you should have a very large shared interest, which is the best care for that patient, right? And seeing them come to a place of their health being restored, them having, great care. And so then also, I think you're going to start to see some common ground. Okay, maybe we approach this differently, but maybe now we can understand where the other person's coming from, where we can start pursuing some solutions. Okay, and that leads us to the letter S. How can you search out some good solutions, some creative solutions together? And this can be kind of a brainstorming session. It's like, okay, so what should we do? What could we do differently with this patient? Or how can we best work together in a way that we're not going to kind of misunderstand each other or step on each other's feet professionally and so forth. And so that can be this kind of brainstorming time where you're both sharing some options or some ideas. And then E is closely related, that last step, which is to evaluate those options and say, all right, what's the best path forward? Can we agree upon a path forward for the good of this patient, and just that we can work together professionally and personally in the future?
Great. So now that we've heard a little bit about the pause principle, let's go back to those 3 types of conflict and go through some specific examples of each one and think about how we can employ the pause principle to lead from a place of conflict to a place of resolution. So we will start with an issue-based conflict. So I'm going to set the stage here. Let's say you are a new nurse. So you just graduated from nursing school and you're starting a job at a new hospital or maybe on a new floor. And on your first shift, you're listening to the report, and when you go back and you read the treatment note from the last shift, you notice that the patient that you had to provide wound care for, the nurse that last did the wound care, maybe used a method that you weren't taught. Maybe you feel that it's out of date. It's not what you were taught in school, and you're just concerned that this isn't the best approach to lead to healing for this particular patient. So let's implement pause. First, we stop and we prepare. So you're the new person in the hospital. Sure, you have the most up-to-date training, but you need to do your homework here and you need to look at the whole scenario. So don't just look at the note from the last shift. Go back to the beginning of this patient's admission and read the physician orders. Maybe there's a reason why this nurse used maybe this out-of-date or older technique to perform the wound care. Maybe there's some past medical history that needs to be taken into account, or the physician follows a different protocol. So before you jump to those conclusions that your way is the best way, take time to really take a look at the whole picture. Second, you want to affirm the relationship. Now, Matt kind of mentioned this can be internally or actually when you are confronting the person that you maybe are in a disagreement with. So in your mind, just affirm this relationship. This isn't somebody that you're overseeing. This is your colleague. This is your peer. You're not the doctor in this particular situation. So just remembering that you're going to want to have a good relationship with them. You're going to want to be able to collaborate with them, not just with this patient, but on all patients that you're going to be sharing in the future. So when you speak to them, you want to speak in a manner of showing respect and never use a tone that would be condescending. Again, talk to somebody the way that you would want to be spoken to. So again, firm the relationship. Then you move on to understanding interests. So when you're serving on a healthcare team, I would hope that everybody has the same common goal, which is the best patient care and the best patient outcome. So in this scenario, we want the patient to have healed wounds. So again, we recognize that maybe we have a difference in approach, but ultimately the same goal is being shared here. So then you can move on to search for some creative solutions, brainstorming, and then evaluating the situation objectively. So at the end of the day, if you go back, you read the notes, maybe you talk to your nursing supervisor, and you still feel that maybe the method that you were just taught and trained in is the best for this particular patient, you need to go with some objective evidence to that fellow colleague. So maybe print out a peer-reviewed journal article or some research that you can show to them and say, hey, I understand why you've been using this method, but I wanted to show you maybe this newer method that I think could be really beneficial for our patient. Maybe they've just never learned it. They've been, they have more experience than you, but you have, education that maybe is newer. So, this could be a learning opportunity for both of you. Maybe that nurse could share some of their experience with you, and you can show them maybe a new technique that they weren't aware of, and ultimately work towards providing the best care for that patient. So next, let's move on to an ego-based conflict example. So in my opinion, these types of conflicts are probably the most difficult to work through. So you just start from a place of having a high emotional charge. So again, let's set the stage. You're working on a busy hospital floor. So you're reading through the physician's orders, and before you administer the medication, you run into that doctor and you just question, hey, is this the right medication before I administer? So in that moment, the doctor takes your questioning as a sign of distrust for their expertise. They lash out at you publicly in front of other colleagues, in front of the patient, and then proceed to report you to the nursing supervisor. So this is a really tough situation. And this is hard, again, because you're probably embarrassed, humiliated, just like feeling really down and disrespected. But we have to implement pause, and you need to prepare. And this is going to be a level of internal preparation. So this is a highly emotionally charged situation. The worst thing you can do is to react emotionally yourself. And that's really hard. This is going to take a level of humility on your part. That you need to step back and take a deep breath and realize that, this maybe their response was inappropriate, but I cannot respond emotionally myself. And then I'm going to jump actually ahead to understanding interests. Again, remembering that we have a shared commitment to providing the best patient care that we can. But, maybe you just caught that doctor at a wrong time. It's a busy hospital floor. They could be, dealing with a lot of complicated cases, and that you need to recognize that that's a lot of pressure. And so maybe just in that moment, it just wasn't a good one for them. And so thinking about it in that way, it kind of takes that personalization out of it. So it's not a personal attack on you. Let's try to think the best of everyone involved. Mm-hmm. So next we move on to affirming the relationship. And again, this is kind of an internal process as well as an external one when you actually confront the person. So internally, you need to remind yourself of your relationship to the doctor. So in this case, you're the nurse and they're the doctor. This is their patient. You are carrying out their orders. So you need to remember that and just kind of reframe that relationship in your mind. Second, when you actually confront the doctor, which you should, because you do need to confirm that you're administering the medication as they ordered, you can come at it with a sense of humility and say, Dr. Smith, I want to talk about what happened earlier, and I want to apologize if I approached you at an inappropriate time. I did not mean to show any level of disrespect to you. I simply want to confirm that I'm carrying out the orders in the way that you want. So again, that's going to take a level of humility. That's going to be hard, and because I'm sure you do feel defeated. But that is going to bring down that emotion level and hopefully be able to move to a place where you can just work well together, like with this patient and moving forward, and it can be a learning experience for you. And then finally, searching for creative solutions and evaluating the situation objectively. This could just be as simple as asking their communication preference or just thinking about it. Did you make the right move by asking them when they're busy trying to, care for other patients? Maybe you should have asked your nursing supervisor, or, maybe the next time you talk to them, you preface the question with, is this a good time to talk right now? Can I ask you a question, or is it not a good time? Just using the conflict as a way to grow personally and professionally, and maybe just evaluate your own skills. Maybe you should have known the answer to the question. So, just evaluating what was my role in this conflict and how can I do better to prevent it from happening again. So finally, we'll go through a values and ethics conflict example. So again, you're a nurse working in a hospital and you're in a patient room taking their vitals, administering medication, and they are having a full-blown argument with a family member about their particular beliefs and maybe some political views that you disagree with. So again, we'll prepare. Let's take a moment, let's step back, and let's not respond emotionally. And that might be difficult. Maybe they're saying things that you just truly do not agree with. However, you need to take the step back. Don't react emotionally. It will not help in the situation. Then you need to, again, affirm that relationship. So mentally affirm, remind yourself, this is my patient. It's my job to be caring for them in this setting. So ultimately, my opinions don't matter in this situation, or it's not the time to be sharing those opinions. So first and foremost, you're the care provider, they're the patient. That's what needs to stay at the forefront of your mind. Then you can move to a place of possibly understanding their interests. Now, I would say, as I already shared, in this particular scenario, you may need just to absorb and not share your opinions. That would probably not be appropriate. However, if the patient invites you to engage and it's appropriate for you to do so, you can take the time to maybe ask why they believe what they believe and learn where they're coming from. By taking the time to listen to somebody, that in no way diminishes your own views, your own opinions. It's showing care for them, that you care enough to take the time to understand where they're coming from. And hopefully that can help you to grow, to learn how to relate to them and care for them better, but also relate to others better in the future. So those are 3 examples of how we can implement pause successfully, but as we already mentioned, that's a lot easier said than done.